Good afternoon and welcome to Vancouver Consumer. I'm Stirling Faux, and in just a few moments, Dean Kotopski, founder of the Performax Health Group in Burnaby, returns to our show to talk about pain management and living a better life through exercise and therapy. Welcome back to the program this Saturday afternoon. I'm Stirling Faux. A pleasure to welcome back to the show the founder of the Performax Health Group in Burnaby and the proprietor of Force Balance Technique. The one and only Dean Kotopski is back at CKNW. Hi, Dean.
Hi, Stirling. Thanks for having me.
Well, thanks for having me over to your shop. We were talking on Dean's last visit here about alignment. If a person, we use the old car thing because Dean's a car nut from when he was a little kid. And we all appreciate car analogy. So when something's wrong with a car, what do? They put it up on the hoist. And they take a good look at it, and they find out where what the problem is, and either replace it, repair it, pull down the hoist, and off you go.
You got hoisted this week.
I got hoisted. Boy, I got figuratively, friends. There wasn't actually a hydraulic involved, but I was involved in the evaluation process and learning a little bit firsthand about something called Force Balance Technique. Now, this is a registered proprietary treatment technique that Mr. Kotopski owns, and it's a process of having patented right now. Those applications have already been filed, right?
Yes, they have, yeah.
Okay, so this is something that is already being viewed by your peers in the industry as a really viable thing, which is why you have it patented. Tell us a little bit about Force Balance Technique, Dean, and where it came from. First of all, what is it?
Yeah, great question. The elevator speech is it's a three-tiered system of treatment. First tier is what we call the hardware upgrade, where we align and mobilize your skeleton and your joints and your musculature. And then in the same treatment session, we'll put our Force Balance Technique stim machine onto the joint that we just mobilized, and teach the muscles and move the muscles through patterns of movement, not so much for strengthening, but for to reprogram the movement. Mm-hmm. And then we move you through that process, for 3-4 treatments, 5-6 treatments or such. And if you're responding well, we're good. We'll see you later.
Yeah.
The vast majority of our clients respond quite well to it. And that's really mostly what they need. They're given a home program and see you later.
Now, you said to me, and I heard you say it to another client as well, we really don't want to see much of you around here.
It's not that we don't like you guys. It's expensive.
We're busy, and you don't need us as much as you think we do.
The resort, it's not, you're just not just paying for the treatment, it's the time to get there, and then the time to, and then you got to drop your kids off, or you got to make room for whatever.
Sure.
So, yeah, rehab is expensive in a lot of ways. That's one of the things that led to Force Balance Technique, but wanting to create a more efficient system of a resolution. If we can't get you there in that say half dozen treatments, we go back to the drawing board and we want to get some imaging. Most likely, if you haven't had it, we're going to get some imaging at that point: X-ray, CT, MRI, ultrasound. We do have in-house ultrasound that we're looking at you through as well, seeing what's up, mm-hmm. Which is extremely handy. And then so we'll take a deeper look. And then if that's not, we're not getting you good there, we're going to start looking at regenerative therapy. And unfortunately, Health Canada has restricted or shut down the use of stem cells, which isn't a terrible thing. We still have access to PRP, but we want to look at healing the tissue.
What's PRP?
Platelet Rich Plasma.
Okay, so it's kind of like a blood transfusion minus the blood, because plasma is a part of blood, but it's like it, though,
That's
right?
correct.
Okay.
Yeah, except we're not going intravenously; we're going locally. So we take your blood, we spin that blood in a centrifuge. We separate the blood cells, the red blood cells, from the plasma. You're left with the plasma. That's rich in platelets. And platelets are your healing factors. They're your healing cells.
And that goes right back into your own body.
Yeah. And so say you've strained a tendon. So this is why I say about efficacy of process. I'll give you a quick example. I had a lady come in the other day that was 9 months. She'd had, I think she said, 43 physiotherapy sessions for shoulder pain.
Wow.
She was a patient of mine way back. She actually heard me on the radio because she couldn't find me. She thought I'd moved or whatever. Anyway, she came back and she said, "Oh, I've had this going on." So I did some of my orthopedic testing. We figured out right away she wasn't surgical, but she couldn't resist me. And I knew right away there was a rotator cuff strain. Pulled out the ultrasounder, had a look. I'm not allowed to diagnose. It's just for my own purposes, my own investigative purposes. But there was an obvious tear in her what's called the supraspinatus muscle. Immediately, I said, "You know what? Enough of this." I gave her some stabilizing loading patterns to do just to kind of get her going, and immediately we referred her for PRP. And so she's 2 weeks in now. She's sore and moving, but she's on her way. That lady will be resolved. I'm going to give you another quick example.
This plasma replacement.
Platelet Rich Plasma.
Platelet Rich Plasma.
Yeah. You could come up with another one too. Plasma replacement protocol.
Right. But what I'm asking though is this effectively, because you discovered a tear in one of this woman's muscles. So instead of a surgery requiring approach to fixing it, which could have worked, you've gone a much less expensive.
She wasn't bad enough, but eventually she would be surgical. Sure. Yeah.
So you just headed off at the pass,
correct,
so to speak.
Yeah, and so this is, and once again, I'm just speaking to my experience in what we do at our clinics. When you're not making gains, when you're not making appreciable gains, after we baseline your power, we use dynamometric testing. We'll tell you within 1/10 of a pound how much you're resisting us. We want to see those improve, your ranges improve, and so on and so forth. But if you're not making those gains quickly and effectively, you need to change your protocol. 6 treatments in, if things aren't going well, the answer isn't to do 6 more of the same.
Right.
And we wait and see. I call that Tuesday, Thursday approach to therapy. I'll see you next Tuesday, Thursday for the next 6 months. Right. That's not effective.
You have a 6 treatment sort of cycle after which
six treatments.
There's another evaluation.
Yeah. We're evaluating you all my therapists, and any good therapist is evaluating constantly. You're evaluating and then implementing. Right. Just like you would with a car. You make a tweak on it, you take it for a test drive, you come back and you retweak it. Sure. So and that's progressive, right? So just to kind of finish off this example, we've done many of these. I'm just giving you one example. I had another lady, same thing, fell during Christmas making dinner. She tripped over the hearth, instant tear. She said it was like a chicken bones cracking. She said she heard. Ow. Anyway, she came in, she's a great lady. And same thing, we PRP'd her, it was a bit sore. It's a little bit of a pain. Pain can be a bit of a painful process. But within the first 4 weeks, she could barely lift her arm past 90 degrees. Within the first 4 to 6 weeks, Stirling, she's up to 160, 170 degrees of range. Now, I'm not saying that's going to be everyone's experience,
right,
but when it's so very cut and dry that we have a tendinous breach or a ligamentous breach, we don't start with the injections, but if you're not responding quickly, we immediately go to injections because that's what's going. The level of evidence now. I think I mentioned last show. I was just in Chicago in June.
Big convention, yeah,
absolutely, the largest orthobiological convention in North America. Orthobiologics are the use of PRP, stems, exomes, these sorts of things, cells from your body. The evidence now for knee osteoarthritis, for tennis elbow, rotator cuff strains and tears is excellent. Level 1 evidence. That's why they're concerned about the stem cell stuff, because the evidence isn't there. We're showing promise, but the grade 1, the level 1 evidence, the RCT, randomized control trial, high level evidence just isn't there yet. It will be. It will be. And I don't want to be too unhumble when I say this. I say that, but I will say it. PRP, the evidence is catching up to what I've known and been doing for the last 11 years.
Right.
And that's just how it was. I was seeing results with prolotherapy 22 years ago. I was ostracized by some of the medical community, doctors and stuff. Who's this upstart massage therapist? How dare he refer people for this prolo? There's no evidence. But guess what? we couldn't argue with the facts that I was seeing.
And now 20 years later, there's a library full of evidence.
There is.
Yeah.
Absolutely. And 22 years later, we have a process called force balance technique integrating biomechanical help with orthobiologic therapy. We dovetail those to the best of tissue healing and the best of biomechanical resolution.
Dean, do you find people, though, when you start talking about needles and injections and things, do you find people get a little skittish and going, is this like legal?
Yeah. Well, it's not about the legalities, I don't think,
but I'm sure
so much
people
anymore.
ask you that still.
Yeah, I do get it.
Needles. A lot of people freak out about needles in the first place.
You know what? When I first started doing acupuncture in like 2004, it wasn't commonplace to see a physio doing that. But I got to be honest, most people now, when I say, look, we're going to do some acupuncture, they're on board. And they're actually extremely appreciative of it. So I do IMS as well.
Let me just stop right there. Because I visited Dean's Performax Health Group on Kingsway and Burnaby on Wednesday morning, friends. I'm not a young man. I have never had acupuncture before in my life, ever.
Yeah.
And so all of a sudden, we're going to give you some acupuncture. You feel a little pinch.
Should we comment on your expression?
But I just have to tell you, it was an absolutely wonderful experience. It didn't hurt a bit.
Yeah.
I felt the human pin cushion there for a few minutes while all this stuff was being, but it didn't hurt. Yeah. And then eventually they all kind of got wired up, and there was a little massagey thing, electronic massage thing. It was fabulous. I really enjoyed it. Yeah. Want you to take a second and tell our listeners your story. You graduated a registered massage therapist, an RMT, after the BC program. And before you got your first gig as a massage therapist, you took the summer off to clear your head, and you went out to one of the Gulf Islands and worked for a construction company. And on the job site, there was a serious accident. You come by your current career dealing with people in pain, quite honestly. Tell us about the accident. What happened?
Yeah, we were erecting a weight-bearing wall that ran through the center of this house. The wall was probably 600 pounds plus, and the bottom plate, which is the base of the wall, if you will, as we had it up to our shoulders, it slipped. And the studs came down and they crushed two of the four guys. I got thrown off the deck. It broke my boss's back in 4 places.
Wow.
I got thrown on the deck. When I realized what had gone on, I jumped back onto the deck and I deadlifted the wall off him. So we did one of those incredible Hulk things where you tap into your...
People do that with cars and traffic accidents.
Yeah, I was so scared for him.
Sure.
He's screaming and carrying on.
Of course.
Anyway, so we got this wall. Unfortunately, I blew out 2 of my discs.
Doing the big move.
Sure. And I torsioned my pelvis. And, that was... I just graduated as a massage. So I thought to myself, okay, we'll heal this. I'm just going to have my friends work on me.
Sure, I'm a massage therapist. I can fix this.
We're good, right? Yeah. Absolutely. I was full of bright-eyed, full of vim and vigor. And the fact was that 6 months down the road of having a bunch of massage and stretching, I was in terrible shape.
Right.
And the massage was offering some relief. It certainly was. It did help. But it wasn't offering any sustainable relief for me. That experience basically galvanized my understanding of the medical system, or the rehab medical system, in how fragmented it was, and ultimately how inefficient it is. I've said this before. I'll say it again. The way I view it, it's just my opinion, is that we have created these tool schools. We all learn about the car. We learn about how it breaks down, being the body, if you will. Yeah. And then when you graduate, physios are handed, screwdrivers and wrenches. Massage therapists get wrenches. Chiropractors get screwdrivers, and on and on it goes. Now right. I'm generalizing, but truly, in order to fix anything, including a human, you need a full complement of tools, and you also need a systematic process. And much of the rehab that's going on today, unfortunately, is symptomatic in nature.
They're working on the symptoms rather than trying to find what's causing the symptoms in the first place.
Yeah, if it hurts here, let's
fix the hurt.
Let's look there first. And oftentimes in chronic problems, that's not even the source.
So an interesting, very personal beginning to understanding the need for something that's turned into the force balance technique. a proprietary technique owned by Dean Kotopski, founder of the Performax Health Group on Kingsway in Burnaby. Lots more with Dean, including your calls. We'll open up the phone lines, but first, the news. Welcome back to the program for a Saturday afternoon in Vancouver. I'm Stirling Faux, joined by Dean Kotopski, the founder of the Performax Health Group in Burnaby. They're right on Kingsway at Gilly. The website is FBTnow.com, FBT for Force Balance Technique. This is the proprietary technique our guest has been talking about. Dean, as you were you talked about you graduated from massage college as a registered therapist. You got all banged up in an accident that really sidetracked your launch of your career until you got better. But part of healing yourself and learning about more than dealing with symptoms, dealing with the holistic approach, you started to put together as an injured worker and a therapist graduate, you started to put together the basics of force balance technique. And as a young massage therapist, once you got back into the studio and started working again, you were working with a group of young women who were doing postnatal fitness classes. Now, how on earth did that exercise coordinate or connect to force balance technique?
Yeah, I read a few books early on in my career, one of them being The Spinal Engine by Serge Grakovetsky. Any of you therapists out there that are looking for something to enlighten you, maybe change the way you think, I would seek that book out. Anyway, I read that and a few others, and it really changed how I was looking at the core of a human.
Okay.
And then I realized, I started early in my career, and I was noticing this pattern with postnatal women and prenatal, the low back, hip, and groin pain. And a lot of them were coming in unbalanced. So I sort of devised an alignment assessment, if you will, for the pelvis. And the vast majority of them were way out of line. They all have the same sort of presentation.
Now, would that have just simply been a cause and effect, having been through 9 months of pregnancy and delivering a child, and then here you are a couple of weeks later going, gosh, it don't feel very aligned, and it turns out you aren't. Yeah. Is that a natural thing?
Yeah, sure it is. Yeah, you've got relaxin coursing through your system earlier now than we had originally understood. Which is a hormone that releases or starts to loosen your ligaments, if you will, prepare the pelvis for
delivery.
And to open really. The unfortunate part is after you deliver, you don't necessarily come back straight.
Right.
And like I said, they were prenatal as well. Like hopefully that's the right term. Yeah, prior to delivery, these ladies showing these low back, hip, and groin pain, and then I started to do some. You know what? You got to be very careful when you're treating pregnant moms, but I started to do some balancing work with them, and because you can't really get in and do too much aggressive stuff with them, but just some light balancing work, and almost all of them were reporting improvement, like reduced pain and stuff. So I knew I was on to something there, and I mean it's a big long. You can go to my website and kind of see the history, more of it. I'm doing talks on this all the time as well, but that really led to a complete understanding of how structure is very paramount. Like when I build a car, I start with a frame, and I start with make sure that frame is aligned and stable, because it's going to have to move through the course of its career, and I drive my cars hard, so. When we build a building, it starts with a foundation. It starts with and that foundation has to be aligned and stable to support the structure that's going to be built on it. It's no different with the pelvis. So a lot of these chronic low back problems and hip problems.
And this is why I ended up there earlier this week.
That's right.
I am a pretty typical Canadian guy with a sort of shot lower discs in my back and chronic pain. So why not go see the Performax folks? And what an interesting experience it was. But that's chronic pain. That's living with chronic pain.
And unilateral. I'm not going to get into your specific
thank you for
situation, but actually, Stirling, you came presented pretty aligned.
Pretty aligned. Yeah. I was floored.
It had a little weakness there on one side, and that's typically what happens. So the bottom line is like I said, it's if you've got 2-3 weeks of pain going on, and a massage or a chiropractic manipulation, some IMS, some strengthening, whatever, a lot of times that will be good enough to take it away. Those aren't the cases I'm talking about. This is the chronic stuff. And it turns out 80 to 85% of these sufferers have malalignment. All I've gone and done is create a process to align that. It works very well. And then if it's not holding, then we do the regenerative injections with it.
Okay.
But just to get back to the analogy, the bottom line with me is, and I had a patient say this to me the other day, I asked her if I could use it. She said a lot of this is icing the cake before the cake has finished baking.
Oh. So
you're putting the cart before the horse. I mean, there's a ton of analogies, but strength from a muscular contraction is highly dependent on the integrity of the joint and or joints that it crosses. So if the joints, so let's say you take your pelvis, you twist the pelvis, well, you're going to twist the vertebrae as well down low, right? So if someone would have said to me early on in my career when I was massaging low backs, for instance, and after my, 12th visit, I'm trying my best, sweat pouring off me, all the advice to stretch. Someone would have said, hey, Dean, you might want to check the alignment and the stability of the joints beneath the musculature. That would have triggered me a whole lot sooner.
Sure.
Ultimately, Serge's book really helped me out there. But that's what we do. The difference between our technique and most others is really, I want to take the time to get to that source. And if you smash your car into a wall, you're not concerned about the headlight or the fender. The first thing they check is your frame.
That's right, yeah.
And it has to be right and perfectly right. If not, it doesn't matter what muscles you're working, what joints you're adjusting, what, strength, so on and so forth. Like I said, once again, a lot of this is, you need to do some strengthening. Well, I get people what I call table strong, which means if I align and mobilize you on the table, immediately I get a strength response through that muscle that improves. And we showed it with you.
Sure. Yeah.
We've showed it with many others. Once we get that happening, you're on your way. That's the biggest part of this, right?
So can I ask you a question without putting down or putting the knock on any of your competitors? Because it took you quite a while to figure out.
It's taken me a long while.
That, treating the symptoms is fine for temporary, immediate, short-term relief.
Sure.
But ultimately, it's not going to fix what the real problem that's delivering those symptoms in the first place unless you do some investigation. This is what the force balance technique is about. It's investigating your frame. It's literally putting you, figuratively, of course, on the hoist and checking your alignment. Without proper alignment, nothing else really matters and can't properly be fixed. It's that simple, isn't it?
Yeah, it is. Absolutely, it is that simple. Unfortunately, the schools that are teaching us how to do whatever, well, man, I'm going to get in trouble. Let me back this up. It has been my experience that the education that I've been subject to never made that a big deal at all.
So it was incomplete.
It was. I would consider it extremely incomplete. Okay. Yeah, because truly is not our goal to create, like you said, I like my clients. I don't want to have to see them there all the time. I can't ask people to come back when I'm shooting in the dark. And I'll tell you what, I had to do that really early on in my career, and it really bothered me. I actually took sabbaticals from my treatment. I couldn't fake it anymore. I actually quit being a massage therapist when I was getting my physio degree at UBC.
Because it wasn't working well enough.
The more I was learning about this stuff, I'm like, oh my goodness. And I'm not here to hack massage therapy.
Yeah, right.
My goal is resolution. And that's what brought me to that. And that's what brought me to my alignment techniques, LKC1 we call it, and our mobility techniques, and now using the EMS or the FBT stim machine to reintegrate your movement. And then finally, the orthobiologic piece is the icing on the cake. And that, like I said, that lady that we had in, with 9 months of physio, 40, what'd she spend? $4,000, a lot of time, a lot of frustration. She comes in and we see an immediate tear, and I'm not going to do any more therapy at that point.
Sure.
These small tears can be fixed brilliantly without
invasive surgeries.
Without invasive surgery, with Platelet Rich Plasma. Like I said, and I said it on your past show, Dr. Brian Cole, he got up and stood up in front of the whole conference and said, I am an orthopedic surgeon, and I do not surgery 80% of my clientele. I use regenerative medicine. That is extremely fascinating.
Performax Health Group is a rehabilitation clinic that focuses on one thing: sustainable results. They specialize in a revolutionary treatment system called Force Balance Technique, or FBT, which offers smooth, powerful, and pain-free movement that lasts. This is right on the front page of the Performax Health Group website, which you can find online at fbtnow.com. Or if you're old school and long-handed like me, you go to performaxhealthgroup.com. Either way, you end up at precisely the same spot, and you start to learn about Force Balance Technique. This is still an evolutionary process. It's patented or patent pending, and it's also registered. It's trademarked. It's all that stuff, but it's still also evolving.
It's a fluid model.
Yeah.
Absolutely it is. You know, the most beautiful gift for me I have, other than my children and my life and my wife, is the gift of learning. The gift of knowledge, man. I'll tell you what, my daughter asked me, we're getting off track here, but my daughter asked me a little while ago, Daddy, you know, she's my 12-year-old, what should I be when I grow up? And I said, sweetheart, whatever gets you out of bed in the morning and puts a smile on your face and makes you want to go do what you do. And I'll tell you, honestly, you know, except for the occasional day, that's me. I don't have a job. This has been a lifelong passion. I'm extremely passionate about this. I love, hey man, I'm a guitar player as well. I love that. I love cars, man. But I've molded it all. I love watches, you know.
Sports.
And, you know, I embarrass myself at Cirque du Soleil because I'm the guy sitting beside you with tears in his eyes because I can see that, you know, I can see the anatomy moving and appreciate the movement and the strength. And few things bring me more pleasure than having someone limp their way into my clinic, and after a certain amount of time, you know, they're out and they're actually enjoying what they want to do and sustainably enjoying what they want to do, and we've empowered them, right? You know, that's not a job, bro.
No,
that's not a job.
It's a calling.
Oh, sure. Yeah. Well, I've said that too. You know, I didn't pick my career; it sort of picked me.
Well, yeah, but it is, and it continues to evolve. Now, I should also tell you that the Performax Health Group is located in Burnaby on Kingsway, 6170 Kingsway, right there at Kingsway and Gilly on the south side of Kingsway.
We have a sister clinic as well now in kinetics medicine. I believe it's 2225 West Broadway. That's where we do the high-end injections with Doctors Bala and Helper and Gray.
Okay.
And Caseman Weingarten. Yeah, I've got 4 associates that are just phenomenal. They opened up a private clinic with a fluoroscope, which is X-ray guided imaging while you're doing your injections. It doesn't get better than that. Dr. Helper, I've been working with Stephen for years, and you know, we've kind of joined forces, if you will. So we'll soon be out there as well doing our rehab. Currently, we're just doing our injections out there right now.
How much of this alignment business is starting to get out there, Dean, because you've spent literally half of your life developing this force balance technique based on your understanding of the need for every human being to be aligned. Mm-hmm. I mean, if we can manufacture vehicles by the millions that are perfectly aligned, we can certainly look after each other and our own personal alignments. It's a physical thing. It can be done. And yet, are you finding now, as you continue to succeed with force balance technique at the Performax Health Group, that more and more of your peer group are beginning to recognize the common sense need for understanding alignment? I
think very much so. I think every therapist has maybe not an innate, but maybe potentially a taught understanding of how important structure is, and then your movement through the movement of that structure, biomechanics in and of its nature. I don't think this is not commonplace yet, because I've got new students. We work with UBC and we take students in, and
great group of young people too working at your
we're running a group through right now, and but they're not being taught any of this stuff, and that's, you know, it's I don't know, sorry, I'm just envisioning opening a school. I just don't have time for my wife would kill me. But no, it's not being made a big enough deal. Alignment, and it's not just alignment, Sterling. So the alignment and stability of the joint. Right. When you lose stability, if let's say you tear your meniscus in your knee, you've lost stability. Sure. Right. So what our typical approach will be, you know, get the swelling down, get the pain down, get the muscles functioning a little better, and then do some exercise to try and do that. That's great. that tear's not going to go away. What we do is we inject those like right away. Yeah, we don't surgery those anymore unless it's a bucket handle. I've done mine. I've done each knee twice on one knee, one on the other over the last 12 years. Instant. Not instant, 8 weeks and we're good.
Wow.
Yeah, I'm duck walking. We've done this for hundreds of people.
Well, if you happen to want to be in that kind of situation or living with any kind of chronic pain, you might want to just take a second, go online. That's what we always do first. We go to the website and have a look. And then we decide if we're going to go and take the next step, which give them a call. Or you can do it on the website, book your appointment right there just by clicking on the button. The website is fbtnow.com or performaxhealthgroup.com. The phone number is 604-433-0100, 433-0100. Give them a call. Get yourself up on the hoist there and find out exactly, as I did to my amazement, exactly how aligned or not you are too. And if you live with chronic pain, as I do, maybe this is the beginning to a life of, shall we say, much better quality.
Yeah, you hope so, yeah.
Dean Kotopski, thanks for coming by. Thanks for Wednesday. It was a trip and a treat to be put on the hoist and given acupuncture for the first time. We're out of time now. I thank you for yours. Come back and see us soon, please.
I will do. Class act, Stirling. Thank you so very much, bud.
My pleasure. We're back after this.